Welcome everyone, and thank you for joining us this evening for our webinar on Corridor Care, Your Accountability. This webinar will run for 1 hour, and we will be recording this event so that we can share this with other RCN members who haven't been able to join us this evening. By taking part in the webinar, we will assume that we have your consent to record, but if you have any concerns about this, please do let us know. Before we begin, just a quick reminder about the RCN's Respect Charter. RCN staff and members agree to treat each other with respect, recognise and value different opinions, and will respect confidentiality. This is particularly important when we get to our Q&A at the end of the session in respect of patients and yourselves. The webinar this evening will look at what the RCN in Wales has been doing to raise the issue of corridor care. We will look at your accountability as nurses and healthcare professionals and what you can do to keep yourselves safe. We will highlight the support that is available to you and end the session with the Q&A. The Q&A is an opportunity for you to ask questions or share comments. Please post this in the Q&A section. If you are asking a question, it'd be really helpful if you could start your post with the letter Q. Any questions that we don't get to this evening, we will follow up and respond as soon as we can. Links to all the resource mentioned will be placed in the chat section for you. I will now introduce you to Helen Wiley, Executive Director at RCN Wales, who will set the scene for this evening.
Thank you. Diolch yn fawr iawn, Alison, and noswaith da, everybody. Good evening and welcome to our webinar this evening, talking about corridor care. I'm Helen Wiley, I'm the Exec Director here at RCN Wales, and it's really lovely to see so many of you on the call because I know this is a really important issue for RCN members right across Wales. In every area I've been over the last few months, this has been a topic people have wanted to talk to me about. Could I have my next slide, please, Rob? So I just wanted to start by identifying a little bit of the history, really, and I've focused particularly sort of post-COVID, but what I would say is before COVID, I've been in A&E departments and community teams and acute hospitals for probably 20 years, where the issue of overcrowding in A&E has been a bit like a roller coaster ride, sometimes not a problem and sometimes a really, really big problem. But I think since 2023, what I've seen and what members report to me is something that I've never seen before. Many of you will remember when the 4-hour waits came into A&E departments, and it was almost a sackable offence if a patient breached that particular measure. But today, what I see, what I feel, what I hear is a normalisation of care that is so suboptimal as it's making people leave nursing, and it's also making the public not want to use our wonderful NHS services. So I thought it was helpful to just remind ourselves that some of this work started back in 2023 when our RCN UK Congress got together and spoke out about the issues facing the staff, patients and their families. And that was about corridor care being a temporary escalation into spaces where you wouldn't normally care for people. That now feels like a normal thing. So nursing staff trying to care for patients in corridors, in storerooms, car parks, offices, even in toilets with no access to safety critical facilities like oxygen, suction monitoring, fire escapes being blocked, patients being diagnosed and having discussions about their bodies and their futures in public spaces with no dignity or confidentiality, spaces where there's nowhere to really help a patient to be washed, very little toilet facilities, and of course not much in the way of meal provision because they are A&E departments. But members also spoke about corridor care being on wards with patients in front of fire exits or in treatment rooms, and being out in the community, still in nursing homes when they should have been moved into more acute care, or still at home waiting for an ambulance to arrive. So these issues have been very difficult and very challenging across the last few months. And because of that, we have been escalating the work that we've been doing here in Wales. And I'd like to talk you through some of that now, if I may. Can I have my next slide, please? So since that report, we put together a UK report, which was launched in Congress in 2024 in Newport. And that was really where activity started to take off again, putting more and more pressure onto the people in power to try and resolve this. And I know my colleague Abigail's going to put a few links to some of the reports that I talk about in the chat for you, so you'll be able to find them nice and easily. Next slide, please. So across 2024, we've done a number of things here in Wales. We've held a member symposium in July, bringing together decision makers, policy developers, policy makers, trying to get people onto the same page, and also talking through some of the wonderful things that we do have in Wales. You may have heard of the 6 goals and more recently the 50-day challenge, and asking ourselves, well, if we've got all these marvellous initiatives, why are they not making a difference? Why are we still seeing and hearing our members having to look after patients in such difficult circumstances? And we built on from July then in September, where we held a stakeholder conference, again trying to explore these issues and find ways that we could weave across systems to make a change here, because I think we all also acknowledge that there is no single silver bullet that will change what has been coming over a number of years just overnight. And then you may have seen that in November of last year, we put some trolleys outside the Senedd and chairs as well, because care in the chair is something widely reported. And this got a lot of media attention, and it was quite difficult for many of our members who could see the circumstances in which they were being asked to care for people played out in front of the Senedd building. And a number of them spoke about how difficult that was and how much it made them realise that this is becoming very normalised, and that for them themselves, going into work, not being able to look at patients because the quality of care was not where they wanted it to be, has also been very, very challenging. We've conducted some member surveys, particularly about reporting, because one of our main top key concerns here is about patient safety, and we know that it's our members' top concern as well. We've contributed to and educated members of our Senedd. It's our parliament, it's where power is. And we opened up as well an email, your member of the Senedd, for members and members of the public. And so far, over 800 emails have been sent. So if you're on this call tonight and you haven't done that yet, or you haven't asked your next door neighbour to do it, or your second cousin twice removed, or your friend in the walking group, then please do. And I know Abigail's going to pop the link to that email easily for you to be able to access. The more of these emails that we can send, the more the people in power, the people who want to be in power as well next year, can see that it's a concern not just about nursing and nursing's issues, but actually the population of Wales and the people of Wales, and that they deserve to get the best quality care. And then at a local level with health boards, we've been raising issues at the local partnership forums and undertaking health and safety inspections. And I know that my colleague Helen, who I'll introduce you to shortly, will tell you a little bit more about that as well. If I could have my next slide, please. So in December of 2004, we conducted a UK-wide survey of our members and their experiences of corridor care. And when we did it, we didn't think we'd get a huge amount of response. It was pretty close to Christmas. People had had a really difficult few months, and we thought that members would be busy trying to get some time during the festive period with their friends and families, but actually we were overwhelmed by the number of responses that we had to the survey. And if any of you haven't read it, please do. It's shocking reading, it's difficult reading, but it's very important reading that we absolutely have to hear. And there are a number of stories and scenarios in that report which just make you feel that if we're not going to speak up for patients, who is? There are stories about changing incontinent, frail patients with dementia in corridors by vending machines. There are stories about not being able to deliver patient-centred care with no oxygen, suction or call bells nearby. And there are stories about dignity of having to support medical staff to do invasive procedures in areas like toilets, etc. And there are stories about fire risks associated with overcrowded departments and no waiting areas for frail elderly people who had to wait for a significant length of time. So if you haven't read the report, please do. If I could have my next slide, please. RCN members are deeply committed to their profession, and delivering care in unsuitable environments has really taken a toll, both professionally and emotionally. And we know that a number of our members that work in this space have had to be away from work with work-related stress. Corridor care, as I said, is beginning to be formed to be the new normal, and it's very difficult when you are in that environment every day to remember what good functioning ED should look like and what a well-staffed ward should be when it's only got the number of patients it should have, or how it feels to only treat the number of patients you should out on the community without all the additional ones being added in. So it's absolutely important that we fix these problems for the future of our well-being and for the future of our profession. Many nurses working in such areas have never known what it's like to work in an area where this wasn't normal. Receiving treatment in open public areas is absolutely not acceptable. And it's not acceptable to not have access to safety essential measures like oxygen and suction and being in reach of a call bell. Experiences of corridor care may lead patients to question the quality and reliability of our healthcare system. And here we are the birthplace of the NHS. We are the home of Aneurin Bevan, and we are hugely proud of the NHS. If I could have my next slide, please. So I'd like also to focus on some of the things we want to do in 2025, but I'd like to also be clear that the we is not me or others who you'll hear on this call. The we is all of us, everyone who's an RCN member, everyone who's a member of the public using the NHS, etc. We are all together have to fight this problem and speak up for the people who are receiving the services that we're talking about. And as RCN members, you can do that by becoming more active in the RCN. You can become a representative, you can join a forum, you can get in touch with us through RCN Direct or by emailing the RCN Wales board. There are many things that you can do as well to support this work and to really ensure that we eradicate corridor care forever. So in 2025, we will continue to put pressure on governments, particularly doing parliamentary briefings and looking for Senedd members to really understand what's going on. We have a general election happening in 2026, and this has to be the thing people talk to their elected, want to be elected government ministers and members of the Senedd when they come knocking on your door. Ask them, what are you doing about corridor care? This year as well, we've been sending public letters out to all of the health boards, putting them on notice that we want them to take immediate action and that they must safeguard patient safety. They've responded and we continue our conversations with them. We've had public letters sent to Health Inspectorate Wales, and we continue to work with them and brief them on the information that our members are telling us. And we've been meeting with other stakeholders. We will meet with anyone who will talk to us about the importance of making sure corridor care is eradicated forever. And we've continued with RCN members and the public to email the members of the Senedd to challenge this and to ask for this to stop. Social media work is going to be building this year from 2024. So if you don't follow us, please make sure that you do. And again, Abigail will put some links into our social media hashtags and names for you to pick up on blue Cloud and Facebook and all the other social media outlets that we use. So please follow us, please like, reshare, use the things that we say if you feel them strongly too. And get involved at a local level. RCN representatives at local level are continuing to raise these issues. You've got one near you, you can become one, you can be the voice as much as the RCN representatives that are currently in your workplaces. So I hope that I have set the scene for you as to the work that we have been doing and will continue to do. And I know that many of the stories I've said are difficult to hear, but I honestly believe if we don't hear them and address them, then we will be doing a disservice to the nursing profession and also to the people of Wales. And now I'm really pleased to hand over to Helen Williams, who's a Royal College of Nursing Health and Safety representative at Hywel University Health Board, and she's also the Wales representative on the RCN's UK Health and Safety Committee. Welcome, Helen, croeso, and thank you for joining us this evening.
Thank you, Helen. I mean, listening to these stories, the scale of the problem can feel overwhelming, but we must not lose hope. While change is complex and takes time, the steps we take to raise awareness and advocate for transformation are essential. Helen widely emphasised collaboration is crucial, and we all have a role to play in eradicating care being delivered in inappropriate environments. As Helen said, I'm a registered nurse in Hywel Health Board. I became an RCN Health and Safety rep more years than I care to mention. I tried to make a meaningful difference in the lives of my nursing colleagues, and not just the nursing colleagues, but all the staff who work at Hywel. The role allows me to combine my expertise and commitment to champion workplace improvements and advocate for better working conditions. The current working environment is unlike anything we've ever faced. Corridor care, once an occasional response to a surge in demand, has now become normalised. And I think that's the most distressing part of it all. In the past, such practices would have been swiftly de-escalated, but now the situation happens day in and day out without resolution. It's unacceptable and must change to safeguard both staff and well-being and patient safety. RCN health and safety reps play a pivotal role in conducting workplace inspections. These inspections generate detailed reports that are submitted to the Health Board committees, local partnership forums, executive nurse directors and chief executives. As you'll see in the slide, the inspections provide comprehensive data, painting a clear picture of the safety risks that weigh heavily on staff morale and well-being. The conversations we have with both staff and managers during inspections often reveal the immense pressures they face. Many express distress over the challenging environments they're working in. These insights further reinforce the urgent need for action. The reports we submit require formal responses from health boards outlining their action plans to address issues raised under the health and safety legislation. This process ensures that concerns are acknowledged and addressed. RCN representatives across all health boards in Wales are working collaboratively to conduct these inspections and track progress on resulting action plans. This coordinated effort strengthens our ability to hold stakeholders accountable and advocate for meaningful changes. We understand the constraints health boards are under. However, the pressures faced by nurses and healthcare support workers cannot go unresolved. Action is needed now to alleviate the strains and foster an environment where both staff and patients can thrive. I would like to take a moment to encourage you as nurses and healthcare support workers to consider becoming an RCN health and safety representative. There are 2 health boards in Wales that do not have a health and safety rep, and I really, really hope that we can get someone to join our band. The role offers a unique opportunity to make a direct and tangible impact in your workplace. As a rep, you are empowered to advocate for safer environments, ensure staff voices are heard, and drive meaningful improvements that for both colleagues and patients. It is a chance to use your skills, experience, and passion to champion change and be part of the wider network, working collaboratively to tackle the challenges in healthcare head on. We will share with you at the end of this evening how you can find out more about the RCN rep roles, the training that is provided, and the ongoing support that you receive in the role. For now, I'm going to hand over to Ali, who will highlight what you are accountable for when delivering care in such challenging environments. That will hopefully allay any fears you might have and the support that is available to you.
Thank you, Helen. Could we have the next slide, please? Thank you. As registered nurses, the NMC code serves as the foundation of our professional practice. It is a constant reminder of our responsibilities, not only to our patients, but also to ourselves and our profession. In today's healthcare landscape, where pressures and challenges are ever present, the importance of patient safety must remain at the forefront of our duties. In these difficult times, playing your part means taking proactive steps to uphold the standards of care outlined in the NMC code, whether through reporting unsafe practices, seeking support when overwhelmed, or sharing insights to drive improvement. Every action you take contributes to better care and stronger professional integrity. Standard 16 of the NMC code emphasises our duty to act without delay if there's a risk to patient safety or public protection. Even in the face of overwhelming pressures, adhering to this standard safeguards not only our patients, but also our professional integrity. Let's explore the specific action Standard 16 outlines to ensure patient safety. Raising and escalating concerns. It's crucial that we use all available channels, both locally and in line with the NMC guidance, to raise concerns about unsafe practices or environments. Protecting your role. If asked to practice beyond your role, experience or training, it's essential to raise these concerns immediately to protect yourself and your patients. Speaking up and taking action. Identifying problems that might prevent you from working within the code and addressing them early is key. Taking prompt action where possible demonstrates proactive commitment to patient care. Supporting others. Whether it's responding to concerns brought to you or ensuring no harm comes to colleagues or patients who raise issues, fostering a supportive culture is integral to the code. We know the environments you work in can be incredibly demanding, but adhering to the code is about more than following standards. It's about preserving the essence of safe, compassionate nursing. While fulfilling our duty to patient safety, it's equally important to protect our own professional standing and well-being. NHS Wales also has a code of conduct for healthcare support workers, which forms part of your contract of employment. Just like the NMC code, it is designed to provide protection for the public and sets out standards of expected behaviour. There are 9 standards in total. Standard 1 highlights your accountability. You must be able to account for your own actions and omissions. If you're working in an environment where patient safety is compromised, you have a duty to report this as set out in Standard 9. So what can you do to raise concerns, adhere to the code and protect yourselves as nurses? DATEX reporting. DATEX serves as an auditable tool for raising and documenting concerns within your workplace. By using this system, you contribute to building a body of evidence that can drive meaningful change and improve safety standards. We understand that DATEX as a tool can feel cumbersome and frustrating. Many of our members have expressed their concerns, sharing that they often see little point in completing a DATEX report. The lack of feedback and perceived lack of action can make it seem like these efforts go unnoticed. Despite its limitations, documenting concerns through DataText is absolutely essential, and here's why. It builds the body of evidence. Every report contributes to a robust data set that highlights persistent issues such as corridor care. RCN reps rely on this evidence to work in partnership with health boards, challenging them to address unsafe practices and environments. DataText reports provide tangible proof of the issues nurses face, empowering us to push for change in local partnerships, forums and beyond. Without this evidence, the issues we experience may never be formally acknowledged or addressed. By completing a DataText report, you are playing a crucial role in creating the foundation for systemic improvements. It's not just about highlighting problems, it's about paving the way for solutions. The RCN advocating for improvements to the DataText process itself, pushing for better feedback loops to keep reporters informed, more streamlined reporting mechanisms to reduce time burdens, and greater accountability within health boards to act on the evidence provided. Your input is vital in identifying these areas for improvement and strengthening the system as a whole. The RCN Raising Concerns Toolkit and template letters have been developed by the RCN as a comprehensive toolkit to guide you through the process of raising concerns. It includes letter templates and detailed guidance to empower you to act confidently and effectively when addressing safety or practice issues. In addition to completing a DataText report, writing a letter or sending an email can serve as another effective way to raise your concerns in line with your codes. This approach allows you to document and address specific issues directly to relevant stakeholders, whether individually or collectively as a group of staff. These written communications shouldn't be seen as a replacement for DataText reporting, but rather as a supplementary measure. While DataText provides an institutional record, a written letter or email allows you to clearly articulate your concerns with detailed examples. Address your messages to individuals or groups who are directly responsible for implementing changes. And you keep a personal copy for your records, demonstrating that you have raised concerns in a professional and appropriate manner. Maintaining a personal record of these communications is vital. It provides evidence of your adherence to your code of practice and reinforces that you have taken proactive steps to raise concerns about patient safety and working conditions. These records can be invaluable if issues need to be escalated further or revisited at a later stage. Collective letters or emails sent as a group of staff can be particularly powerful. They highlight that these concerns are shared and demonstrate a united front in advocating for necessary changes. By leveraging both DataText reports and written communications, you can ensure that your voices are heard and that critical issues are addressed. Many of your line managers understand the importance of raising concerns and are committed to supporting you in this process. They too are navigating the same challenges and recognise that fostering a culture of openness is essential for improving patient care and working conditions. Managers can be a valuable ally in ensuring your concerns are addressed effectively. However, we also acknowledge that not all experiences are positive. Some RCN members have reported facing obstacles when attempting to document concerns. These barriers include resistance from line managers. Some managers may discourage instant reporting, either due to their workload pressures or reluctance to escalate issues. And sometimes there's a fear of repercussions. A number of members have expressed anxiety about potential negative consequences, such as strained relationships or professional backlash if they speak out. It's important to remember that raising concerns is a professional duty and under the NMC code, and you have the right to do so without fear. To navigate these challenges, if faced with resistance, politely reference the NMC code and emphasise the importance of patient safety. Keep a record of any attempts to raise concerns, including emails or discussions, as evidence of your adherence to professional standards. Reach out to your local RCN rep, who can offer guidance and advocate on your behalf if needed. In line with your code of conduct, it's essential not only to protect the health and well-being of patients, but also to prioritise your own. Caring for yourself enables you to continue providing the best possible care for those who depend on you. Here are the key resources available to support you. Seek support from your occupational health department. Reach out to your local rep. Access the RCN member support services that can provide counselling and emotional support, ensuring you have a safe space to discuss and address your concerns. The RCN's website is a valuable resource, offering a wealth of advice and guidance tailored to the unique challenges faced by nursing professionals. For immediate assistance, contact RCN Direct. Open from 8 AM to 8 PM daily, the Advice Centre can signpost you to the most appropriate support and resources we offer. Remember, seeking support is not a sign of weakness, it's a professional responsibility and a key part of maintaining your ability to care for others. By protecting your own health and well-being, you set an example of resilience and professionalism in the face of challenges. We're now going to open the question and answer session. Please feel free to ask questions to any of us here this evening. Okay, we've got a question here from Magella. I'm going to direct this one to Helen Wiley, if I may. How should we support those in the independent sector who feel pressured to take patients to clear bed spaces in the NHS, as Datex is NHS?
Thank you. Lovely question. And it also just helps us remember that the pressure in the system is not just about the NHS either, that it's pressure in social care, in care homes, in primary care and out in the community as well. So, Magella, I think there are some established processes that we can always rely on. So, if you're working in a care home, there ought to be a series of admission criteria that you've been relying on over a period of time to make sure that patients and then residents get to the right place. So it never does any harm to revisit that. Actually, we do have good established processes to take people into the right place at the right time, and we shouldn't forget that we have those. I think sometimes there may be some opportunities to speed up getting patients out of the system and into the best place for them. For me, for many people in hospital who are waiting to go into a care home or back to their own home and to have care and support in their own home, that's where they do need to be. So we do want to try and make sure that we work together to make that happen. And I know, again, from the work that I've seen with the 6 goals, there are some policy initiatives to try and do that. And of course, you'll also have seen the 50-day challenge, where there's been additional resources for health boards to work with social care and independent sector to help move patients where they should be. So I think if we can use some of those resources as well, that we should be doing that. And we should also remember that safeguarding procedures are for everybody. It doesn't matter where they are in the system. So the protection of vulnerable adults legislations and frameworks, etc., apply as importantly in the NHS as they do in the independent sector, and that putting people's as our priority, their needs, their best wishes, their best care is an important way to do that. But inevitably, I can also acknowledge that there will be times when people will be pressured to move faster or do something differently from what they've been used to. I think we need to learn from the mistakes we made during COVID, where we did that particularly in care homes, and look at the disaster that had. And so for me, that's about being active at the RCN, getting involved as an RCN member, and if that's happening in your workplace, talking to us so that we can help you work that through on a longer term basis as well. So hopefully that's answered your question, even if not completely.
Thank you, Helen. Our next question comes from Sarah M. What practical short-term solutions can be implemented to minimise the need for corridor care while we work towards long-term infrastructure and staffing improvements? I'm going to ask Nicola to come in on this one first, if I may.
Thank you, Sarah. What a brilliant question. What a really difficult question as well. What practical short-term solutions can be implemented? I guess we would say that corridor care is a never event, and we wouldn't want any short-term solutions. We would want this not to happen. I guess what we can do is to move people through the system quicker. We would maybe put pressure on discharge in a safe manner, as Helen has just explained, but we wouldn't want corridor care at any time to be a solution in any way. And we need plans in place. Helen mentioned the whole system part of this, and what we need to do is think things through. We can't close A&E doors like we can for anywhere else, so we can't stop the caseload coming in. What we can do is ensure that we've got safe staff in there, that we've got the right numbers of nurses, healthcare support workers and our MDD team. What we can do is to put our most experienced consultants, nurse specialists at the front door so we can do admission avoidance. That's what we should be thinking about. So I'd say we should be thinking admission avoidance, and we shouldn't be, and maybe we need to think about practical solutions within primary care there. We need to use our pharmacy contacts, and we should be assessing people for admission. So I hope that might have answered some of it, Sarah.
Did any of the panel want to add anything to that one? Yes, Helen?
Yes, I will. And I really agree with what Nicola was saying there, because I think the point here is that when you get into short-term fixes, they stop being short-term fixes and they start being long-term reality. And you know, as I go around Wales, I am so proud of my profession, and I see them in A&E departments dragging the standard up, taking people off towards 7 and 8 or whatever it is to help them be washed, getting the canteen to do hot meals when they don't normally do a hot meal service in the A&E department, nicking pillows off other areas. And I'm really proud that they can see the importance that those standards mean to the care that people receive. But I'm really disappointed in that they have to do it all day, every day, and it's become normal. It's become normal. So for me, many of the short-term practical solutions have been maxed out. I do not want to see more people sitting in more chairs for days on end. We have done that, as Nicola said. You know, we've gone for that, and our nursing's led that, and I'm proud to have seen it. But it has to come to a point where it's got to stop. For me, I would say we should be thinking like it's a pandemic again. So when we were in a pandemic, we were able to open up more capacity. And I know the argument is if you open more capacity, you will fill it. But the reality is that the people of Wales are sitting on chairs for days waiting to have care. And that's not even human. So for me, that's the absolute starkness of where we are. I think the initiatives around 6 goals are all commendable. So why are we not getting any traction? It's saying what we've all been saying for 20 years. So I'm not sure there are any more short-term fixes that can be done. I think we have to go with much bigger, wider long-term fixes. And for me, part of that is developing the consultant nurse workforce, because again, many of the people that I see in these A&E departments, on wards and out in the community, that they spend 95% of their care being looked after by registered nurses. It's when they get into an acute problem or they can't access that care that they end up in the wrong place. So for me, developing more consultant nurses, more advanced practice in nursing, managing whole cohorts of patients that we are really good at managing and who get quality of life because nurses manage them, is a model that we should be doing. Moving away from the medical model, we have to intervene with everything, you know, and sometimes we shouldn't intervene, or our interventions should be human rather than medical. So for me, there's a fundamental shift in the barometer that says, you know, are we a health service looking after the quality of your life, or are we always trying to deal with medical issues? And then lastly, I would support, and this links back to the consultant nurses really, more investment in senior clinical decision makers closer to the patient, because they're the ones that matter, and that's where the extra money and the reward and the promotion should be, not moving into management or having to move out into other areas. And again, that's a fundamental switch around. Why are nurses band 5 for all of their career? It's disgraceful, and it shouldn't be that way. Pay nurses more, invest in their education, bring them up to consultant level, and we would be able to fix some of these problems.
Thank you, Helen. We have a comment in the Q&A section as well about reminding us, I think, to also consider the impact for people witnessing distressing situations. So that's not just our nursing staff and patients, but it's the relatives that are in the waiting rooms too, and acknowledging that what they're observing is really quite distressing.
Alison, can I just say on that many patients, our most vulnerable patients, who are sitting for days in those chairs that Helen just told us, they don't want to raise a complaint and make a fuss because they see how hard the nurses and all the doctors are working to help them in those circumstances. So in a way, they're not helping the situation by not complaining, but they don't want to make a fuss. And that's a real difficult thing when they're seeing their loved ones being treated on a chair in a corridor for days on end. It's just shocking.
There's another comment in the Q&A about colleagues working with unsafe ratios in ITU. And I suppose the advice to them too, like it is for all of us, is to keep raising those concerns and completing DATEX so that there's an evidence trail that individuals are doing their best to promote positive change for patient safety and for nursing staff. We have another question that says, some staff have been told not to complete a DATEX as the matrons or band 7 will complete it on their behalf. Please, can we advise them? I'm going to hand that over to Helen Wiley. She's smiling at me.
Always good. And I know Helen Williams will be backing me up on this one and saying, you know, as much as that's wonderful, we are individual accountable practitioners, and for registered nurses, if you feel something needs to be done, then you need to make sure that it's done. Now, there are a couple of approaches to that, aren't there? There's the thank you very much, matron or ward sister, charge nurse, please can I have a copy to make sure that it's been done. But you have to ask yourself, would they be able to put things into your words, or is it your issue to own? And if it's your issue to own, your experience, then that Datex form belongs to you, I'm afraid. And I can understand that staff get really fed up with filling in Datex forms and think nothing comes of them. But I would say keep filling them in, because people like me go around saying how many are there and demand actions on them, and people like Helen Williams bring it up at their health board to say, you know, what's happened in the quality agenda and how many Datexes are there on not enough staff or too many patients in different areas. So I say have faith in the greater good of the Datex system and keep on filling them in. If you honestly think that your matron or band 7 can do it, that's fine. But I would suggest that you might want to just close the loop by ensuring that you've had a copy made available to you.
Thank you, Helen Wiley. Helen Williams, do you want to come in on that one?
Yes, I think it's important to remind people that anyone can do a Datex. It doesn't have to be the band 7, the band 6, the band 5. Band 2 can do a Datex. If they see an issue that, you know, raises concerns, they can do a Datex. Unfortunately, I think all too often minor issues and incidents go, particularly verbal abuse, go unreported because it's the end of your shift. You just want to go home, and it only swore at me. There's no, you know, I'm not going to concern myself with putting a Datex about that, but it is important to put the Datex in. And if anybody the Datex in.
Thank you, Helen. We have a comment in the chat from Tony. It says, many times we have patients who require transfer to tertiary hospitals. Many times we have to cancel their transfer due to ambulance shortages, often due to being sat outside A&E waiting to offload. If we could aid them in offloading, should enable us transfer patients, clearing a bed to take a patient. The problem is the ambulance then gets utilised to pending call. It's a vicious circle. And then we have Sarah M has posted, thank you, Nicola and Helen. With the Welsh Government expanding and facing new leadership next year, what strategies is the RCN using to lobby for concrete commitments on hospital capacity and staffing to eliminate corridor care? I agree that we should be writing to our decision makers, but I do believe it may be falling on deaf ears. The next election is May 2026. I'm worried about my patients tomorrow. Helen Wiley, do you want to
Yes,
talk
happy
about
to
what
take those,
we're doing with lobbying Welsh Government?
Yeah, Tony's comments about ambulances, I think there he identifies some really important issues, doesn't he? We know that if an ambulance is waiting outside a department trying to offload a patient, then it can't pick up another patient, and we know that that if you have a stroke, you're more likely to get taken to hospital by car at the moment than you are by ambulance. So I think he makes a really important point there. I think also it makes me realise that we need to understand what's an emergency transfer and what's a transfer for treatment and other things, and potentially look at some of how we resource that going forward. And then the question about strategies. So I will use every strategy I can possibly think of, and if you're not involved, Sarah, please do come and get involved, because for me this is a short, medium and long-term plan here. So, and it has been for some time, and it does feel quite frustrating that seeing things change takes so long in the NHS in Wales. So, you know, on the short term, we are doing things like saying to members, write letters, rate it with your boss, do a day text, and come and meet with us, have a health and safety inspection, invite your chief executive down. You know, we are actively encouraging members to do all those things in the short term about your patients tomorrow, to bring that to the attention of the people who have the power to actually do something about some of these things. In the medium term, we're doing the wider piece about what, if we've got this wonderful policies like the 6 goals and the 50-day challenge, why are they not working? Because there's nothing not to like about them. They're all very sensible. So we're asking that with our reps at local level, why isn't it working? We're asking that with our senior colleagues and senior nurses, right up to executive director of nursing level, and across and into independent sector as well. And what do we think needs to happen in order to do that unblocking, so that we can say that for them as well. And then on the longer term, we are looking at elections and people who want to get into power, because I think your point about it being on deaf ears is a point really well made. But we know those 800 emails have really changed the focus, and we've got members of the Senedd knocking on our door asking us to tell them more about corridor care, because so many of their constituencies are raising it with them, and they know that's how they'll get voted in 2026. So we are trying to do strategies that are short, medium and long term. We need you, Sarah. We need every one of you. If you think there's another strategy we haven't tried, come and talk about it, and let us help you do it, so that we try everything, and we won't give up until we get some traction on this, because it's such an important issue. So join us, tell us more about what you think needs doing, come and do it with us, and hopefully between us all we will start to see this tanker turning around.
There's another comment in the chat there about the ambulance service being grossly misused by the public. So there's maybe an education piece that needs to go on there as well. That covers all the questions we've been asked online. Does anyone want to raise their hand and speak to us to ask a question? No hands up. Okay, thank you. If we could have the last slide, please, Rob, and we'll start to bring the session to a close. I'm going to hand over to Helen Wiley to do that last closing summary.
A big thank you for this evening's work, everybody, for the staff on the call, for the reps on the call, and for the members who've joined the call as well. What I would like to say is that the links to all the resources we've mentioned this evening are in the chat for you. If you've missed them, then you can email us. There's a generic email for the RCN Wales boards, which I'm sure Abigail will share for us, and we'll make sure that you get those links too. But they're easily accessible. If you use Google Corridor Care RCN Wales, and it will take you straight to our page with all the resources that you need. Corridor care remains to be one of the most pressing challenges in our healthcare system, but together we do have the power to make things change. We're strong as individuals, we are strong as a profession, and together we are even stronger. I believe that nurses, healthcare professionals are at the heart of this movement, and I've been really moved by the number of members who have taken on board this task and have continued to be passionate about our profession, but also passionate about ensuring they play a role in eradicating corridor care. So your voices are essential if we're going to drive this improvement and if we're going to influence the decision makers. We can eradicate corridor care. It's happened in the past and it can happen into the future. Governments are putting money into all sorts of initiatives, and we can bring them to account about that in our employers and of course as members of their constituencies. But by supporting each other and speaking out, we can also ensure that patients have a voice through us and that they have the opportunity to receive the best care that we can provide, and that should be in a safe and respectful environment where their dignity and complexity can be treasured and maintained, and that every nurse then has the tools and the conditions that they need to thrive in the roles that they undertake. The Royal College of Nursing is here to amplify your voice, but we are not for you, we are with you, and we need you to input and collaborate and to join us as members who see this and feel this as part of your professional practice. You can see on the slide various ways to get involved with the Royal College of Nursing. This is your Royal College of Nursing, and we want all of you to be involved. Being a rep is a fulfilling role to undertake. We'll support you, we train you, you'll meet other like-minded reps along the way, and you'll find that it helps you raise your voice, plus the fact that you have protection in law to enable you to undertake it and speak out for the people that you feel so passionately about. So please visit our website to learn more about the roles of an RCN Learning Rep, Health and Safety Rep and an RCN Steward. We have lots that we can offer you, and you have lots that you can offer us. Connect with your branch. All branch members are in an RCN branch, depending on where you work, but it's within a geographical area. So if you work in Cardiff and you're in the health board, you're part of the Cardiff branch. But if you work in Cardiff and you're in a general practice surgery or in a care home, you're part of the Cardiff branch. Branches work right across the NHS and the independent sector, and they want to serve members and provide opportunities for members to participate, shape and influence the work of the RCN. You can find out more about your branch on our website. And then support our campaigns, wear our badges, tweet our messages, share our Facebook likes, repost our Blue Yonder postings, etc. Agitate your MS, tell them you're a member of the RCN and that you're involved in the RCN's campaign, and there'll be more campaigns coming our way throughout the course of this year. So take license to get involved and make the RCN your RCN. I want to say a big thank you for you spending the time this evening with us to talk about this difficult and challenging issue. And I want to say a big thank you for the work that I know that you're going to do in the future to work with all of us so that we can ensure people of Wales get the best possible care that they can. I hope you enjoy the rest of your evening, and I look forward to chatting with you again at a webinar in the near future. Diolch yn fawr iawn, noswyth dda.